Hello, and welcome everybody to the National Trends in Disability Employment,
or nTIDE,
Lunch and Learn series.
Just a few housekeeping items before we begin.
This webinar is being recorded.
We will post an archive of each webinar each month on our website at www.researchondisability.org/nTIDE.
This site will also provide copies of the presentations, the speakers' bios, full transcripts, and other valuable resources.
As an attendee of this webinar, you are a viewer.
To ask questions of the speakers, click on the Q&A box on your webinar screen and type your questions into the box.
Speakers will review these questions and provide answers during the last section of the webinar.
Some questions may be answered directly in the Q&A box.
If you have any questions following this recording, please contact us at disability.statistics@unh.edu
or toll free at 866-538-9521 for more information.
Thanks for joining us.
Enjoy today's webinar.
Hi everybody, this is Andrew Houtenville at the University of New Hampshire, bringing you nTIDE Lunch and Learn for the month of April. The Lunch and Learn is a joint effort with the Kessler Foundation and the Association of University Centers on Disability. Typically we're on noon time on the first Friday when we release the nTIDE jobs report. We are funded by the National Institute on Disability, Independent Living and Rehabilitation Research as part of the Center on Employment Policy and Measurement. We have three parts to nTIDE, 4 parts to nTIDE. We're going to talk about the numbers, then we'll have news from Denise Rozell at AUCD, and then we're pleased to have Valentina Morales here from Wildcat Service Corporation, a Fedcap group. We will save questions and answers till the end, and we'll have questions and answers for all the groups. I'm going to turn it now over to John O'Neill to start this description of the numbers.
Good afternoon, or good day, I should say, everyone. Andrew, next slide.
You should be seeing the slide that says the monthly nTIDE report, John.
Not yet. I still see today's program.
Really?
Mm-hmm.
So I'm showing on my screen.
Here we go.
There
I've got it. Thanks.
Upstate New York is a little slow, I guess.
That's probably the case. The monthly nTIDE report is a press release and an infographic where we look at the latest employment statistics. It's the information, the data is drawn from the jobs report, which is released by the Bureau of Labor Statistics on the first Friday of every month. Next slide, which that came through efficiently.
Good.
The source of the data, as I said, is the United States Bureau of Labor Statistics current population survey. And it's the source of the official unemployment rate, which the media makes so much of, which we typically don't report, but Andrew will get into the fact that we may start reporting that next month. It is a survey of civilians aged 16 to 64 who are not living in institutions. And the information has been available since September 2008 onward, when the 6 disability questions were added to the current population survey. It's important to understand that the data is not seasonally adjusted. That's why we compare the data to the same month last year. What's important about today's data, particularly in the context of COVID-19, is that this data was collected the week of March 12th, and that was before the COVID epidemic became very prominent. And actually it was San Francisco, I believe, that did the first stay-at-home order, and that was only on March 16th. So our data is essentially not reflecting the effect of the COVID-19 pandemic at this time. Okay, over to you, Andrew, for the numbers.
Okay, so thank you, John. One thing to note, as John said, the data doesn't reflect the current situation, because it was really the second week of March and before the shutdown started to happen. We do see actually a slight increase, and so this is similar to prior months. We were starting to see a little bit of an increase for people with disabilities and a slight decrease for people without disabilities in terms of the employment to population ratio. We also see a similar story with the labor force participation rate. The labor force participation rate went down slightly for people without disabilities, but actually up a little bit for people with disabilities. In terms of the employment to population ratio, we can actually see that slight increase for people with disabilities and the decrease for people without disabilities. And so, we were at numbers similar to October, actually September of 2008. So we were actually, you can see the recovery from the Great Recession. If we want to talk about COVID and the impacts of COVID, we will start seeing them when people report that they're on layoff or furlough, meaning they're kind of laid off, but the employer intends to bring them back and they intend to go back to their job. That ends up being in the unemployment rate, right? People they fall out of this statistic, but they wouldn't fall out of the labor force participation rate. So labor force participation rate, you can actually see a slight decline for people without disabilities. That's kind of a surprise, and that may be one of the first kind of telltale signs. If you're listening to the standard media, you'll see payroll, loss of around 700,000 jobs through the payroll data. That's actually a different survey. That's a survey of businesses and establishments that does the payroll data. And the payroll data, unfortunately, we don't have abilities to look at people with and without disability in the establishment payroll data. The unemployment rate went up from around 3.8 to 4.4% in the overall employment numbers that you're hearing in the media. And that's likely the beginning of the response to COVID. Going to 4.4 is actually a very reasonable unemployment rate in any given time. However, it is a big movement since we've been at around 3.8, 3.7 the last in the overall economy for quite a while at what was called full employment. Everybody's expecting this to jump radically in the next month. So in the next month, when we do the nTIDE report next month, we expect to see dramatic jumps in unemployment. And that's why we're going to switch to providing the unemployment numbers, which we typically don't do because people with disabilities are typically looking for work over longer periods of time, and they may be discouraged and they fall out of the unemployment rate calculation. And so that's differential between people with and without disability. I did look at the unemployment rate for people with disabilities ages 16 to 64, and it did go up, but not as big a percentage as it did for people without disabilities. But again, these are just the nascent effects of the lockdown. We are considering and having a big report, a supplementary report in mid-May when the raw data are released. The data that you're seeing that we report in nTIDE is what they calculate and post on their website, what the Bureau of Labor Statistics puts on their website. What they do is 2 weeks after today, they will post the raw numbers, the raw statistics, the raw survey responses. And with that raw data, we're able to look at layoff. So what percentage of people were laid off and what percentage of people are employed but absent from work, perhaps due to illness. we have a lot more flexibility, and we're probably going to do a report mid-May on using the raw data, and we'll be able to look at specific occupations where people with disabilities may be located. Many people will talk about the 4Fs: food, janitorial, flowers, and filing, and many of those occupations where people with disabilities are concentrated may be more likely to be affected by the lockdowns. I can talk about the long-term effects that I, as an economist, I'm a microeconomist, I'm not a macroeconomist, do, but I'll leave that to the Q&A section. I'll turn it over to Denise and the numbers with Denise, or the news from Denise.
Hi, everybody. So I said earlier when we first tuned in, first of all, welcome to my guest room. As with everyone, I'm working from home. I said earlier when we first checked in and we're talking with the other panelists, this is pretty much all COVID related. COVID in employment, COVID and people with disabilities. But when I started putting together the slides for today, I thought, you know, this is what people need to hear right now. So the policy update, I think I said to you last month that COVID and the coronavirus was sucking all the air out of Washington. So really the only policy updates last month were the coronavirus and COVID. Well, that is really true now. Congress is gone. They have done their work for right now. My guess is there will be more work to come on this, but let's do a quick review.
Are they going to use are they going to use Zoom to do Congress?
That's a really good question. They don't have any rules for that at this point. So if they do, yeah, there's a big question about all of that. Right now, they aren't scheduled to come back until April 20th. Our bets are it won't be until May, and then we're just going to have to see. Speaker Pelosi is continuing to say that we need and you'll hear from me in a minute, that we need a COVID-4. We've now had 1, 2, and 3 in terms of legislation. So we'll see. All right, so just as a review, the first bill that they passed, which became law on March 6th, that was just having, so that programs could move around money, basically. It was so that, you know, somebody could move money from program A to program B to cover some emergencies that were going on as we began to look at this crisis. Obviously, March 6th was really early. The second one is the Families First Coronavirus Response Act. That was March 19th. That's the one who said insurance companies have to cover tests. We can have a longer conversation about whether you can actually get tests. But that's what it said. It provides enhanced unemployment insurance to people who are unable to work and increased funding for food security programs. So that was the second one. And each of these kind of ramp up to be in bigger dollar amounts as we go along. Next slide, Andrew. The third one, so what we've called COVID-3, and it's a little confusing for those who might be related to the LEND programs or to autism, the Autism CARES Act, but it is called the CARES Act. So just know that we're talking about COVID-3 when I talk about the CARES Act. There are a number of things in here that are interesting. You need to know. So it says that state Medicaid programs can pay for direct support professionals to assist disabled people in the hospital. That's a big win. There was a lot of problem about who could go into hospitals and what you could pay for and whether your support professional could go with you into a hospital. This says yes, and Medicaid can pay for it. It provides $13.5 billion in formula grants to states, which they then have to distribute into local education agencies and districts. I'm highlighting this one in particular. This is the one that goes through the districts. So to the extent that you are working on transition services within a district or partnering with your local education agency, et cetera, and looking for extra money, this is what that's coming out of. And it's funding through, they're gonna put it through the districts. So starting to talk with your districts, your governors, your others, I'll talk about that in a minute. There's a big pot of money there. Now it's a formula grant, it goes through Title I funding, again, longer conversation. But there is money there that is going into districts, and to make sure that some of that goes to students with disabilities is important. It does not say it's for IDEA. It says it's for students. So it's going to a whole variety of students. who districts believe need services. But it includes students with disabilities. Again, I'll get to that one in a second too. We're asking for more specificity in what we hope to be COVID-4. $85 million for the Centers for Independent Living. That's an important one for you all to know out there too. If you are working with your CILs, go and talk to them. They're getting some additional funding to be able to provide supports in this emergency. So absolutely check in with your CILs. And if you don't have a good relationship, go build one. $50 million for the Aging and Disability Resource Centers. Again, if you're back one, Andrew. If you're connected to those, go and chat with them. No, other way. There you go. They extended the money follows the person and the spousal impoverishment rules through November 30th. So that's a good thing too. Money follows the person continues to the extent that you are working on that in your state. I know some folks on these calls really track that. That's extended through November. We tried to get it, yet again, we tried to get it longer, but we seem to be doing money follows the person extensions in 6-month increments. So that's what we got. And then this one's interesting. I'll talk again about this in a minute. It also waives the nutrition requirements so that older Americans can get can have access to meal programs, and the meal programs have access to SNAP in some ways. So that's one for seniors to get additional meals. I'm going to talk about that because we're asking for more there too. Okay, next slide. So what we found in COVID-3 was while there's a ton of money there, excuse me, and that's a good thing, but it's not very targeted money specific for people with disabilities. So what we're looking at for COVID-4 is saying we need some things that address specifically the needs of people with disabilities in COVID-4. And this is something for all of you to go talk to your members of Congress to talk and spread the word on this one. So for one thing, we had sought an additional $20 billion for emergency needs for home and community-based services funding. We did not get that. We are continuing to ask for that. Obviously, HCBS funding, again, tying back to employment every time, obviously HCBS funding ties into, in many states, employment or preparation for employment, or someone getting ready to go to the office, to whatever your work is, but whatever your work is. That's an important one. And the disability community, and I will say, the disability community on this is really together. Different groups are taking different pieces and promoting them, but the agreement among the community about the things that we need in this next bill and the things that people with disabilities need are, we're together. The consensus is great. Protect the rights of people with disabilities in the face of rationing of care. Rationing of care has become an issue. I don't think that's a surprise for anyone on this call. How do we decide who gets a ventilator? How do we decide who gets meds? If there's a meds conversation, how do we decide where PPE goes? How do we decide all of those things? So that's another one that somehow in this COVID-4 we'd like to see. We'd like to increase SNAP and Meals on Wheels funding in the same way it was increased in COVID-3, to increase that to include people with disabilities. They were not included. It addressed the aging population in COVID-3. This would be for COVID-4. And then IDEA. I do need to say a word here because, again, although this is an employment call, I know everybody on this call cares about civil rights and cares about IDEA. There was a push before COVID-3 to allow the Secretary of Education to make waivers of various pieces of IDEA. The disability community, thank goodness, and in a really strong way, fought it really hard and pushed it back. Right now, what was in COVID-3 was language that says that within 30 days, the Secretary of Education is supposed to do a report to Congress about what she thinks she needs to waive in this emergency, what she needs to waive in IDEA, in ESSA, the Every Student Succeeds Act, in Perkins, which is Career and Technical Education, and in the Rehab Act, so that would be Section 504. We anticipate well, first of all, we anticipate that the things she might ask to waive are things like IEPs, or FAPE, Free and Appropriate Public Education, or some basic civil rights protections that are in IDEA. So I put that out there. And because it's a 30-day, the report has to be done in 30 days to Congress. Now, Congress has to then pass something. Even if she says, the Secretary of Education says, I want to waive these provisions of IDEA, Congress has to approve something that says, yes, you may waive these provisions in this particular time. Well, as I said, we think they're going to be working on a COVID-4. So the worry is that that report will feed something into COVID-4. So obviously, the disability community is fighting really hard about that. There's a lot of flexibility already in IDEA. You do not need to waive civil rights protections in order to get through this time period. There is flexibility. There are other ways to handle it. And there is some really good Department of Education guidance that they came out with, frankly, on a I guess it's OCR guidance, that they came out with over a weekend, literally like on a Saturday night, that says, you know, you shouldn't use this emergency as an excuse not to serve children with disabilities. But at the same time, we know that the Secretary is looking at some waivers. So that's another priority area. And then state outreach, I mentioned earlier, how will you use your coronavirus relief fund? So that conversation with your governor's office, with your state legislators, with your state policymakers, whoever that is, with your districts, that conversation should be happening now. And anyone you know, you should raise those issues so that kids with disabilities, students with disabilities, adults with disabilities in employment are receiving some of that money. Okay, next slide, Andrew. So this is the rationing of care one. I just wanted to make sure you saw this. The Health and Human Services, Department of Health and Human Services, Office of Civil Rights, in this rationing of care conversation, which is continuing and which you would still like to see in a piece of legislation, did put out on another weekend a bulletin that specifically says, and this is the quote, persons with disabilities should not be denied medical care on the basis of stereotypes, assessments of quality of life, or judgments about a person's relative worth based on the presence or absence of disabilities. This also was a huge win. I know, again, for people on this call, you're saying, well, duh, but this was a huge win to have out of the Office of Civil Rights. So, but here's language you can use if you walk into that situation in any case. Okay, next slide, Andrew, and that's the link. There are a lot of links in this presentation. The presentation is downloadable after this call, or we can make it available. I can't remember, it's just downloadable, I think. But there are a lot of links because there's a lot of stuff out there and I wanna make sure you have the information you need. Okay, so one of the questions we've gotten a lot at AUCD is about plain language materials on COVID. And I know for all of you who are working in the employment space, if you're, wherever space you're working in this field, this is useful. Green Mountain Self-Advocates was one of the first ones to come out with something. It's excellent. There's an English version, there's now a Spanish version that's been funded. It's up on their website. These are the links, or you can just search on Green Mountain Self-Advocates, plain language COVID, and it'll pop up. Hesperian Health Guides has a plain language version. It's not quite what I would truly call plain language in the disability world. It's a little more than that. The one Green Mountain is great because it has pictures and drawings and examples, and it's really nicely done. It's a combination of visual and words, all the things you want to see in plain language as we talk about it. Hesperians are more I guess, low literacy, but there are in a variety of languages, and there's more coming. So that's an important one. The picture on the side is one that Special Olympics came up with. That again is very simple, straightforward, plain language, pictures, words, very well done. And then the Lurie Institute for Disability Policy has another one that's really good. So here's a variety of plain language ones in a variety of languages. Next slide, please, Andrew. Another thing that we have, oh, so that wasn't the next slide I thought I was gonna have. That's perfect. No, that's fine, that's it. I must have put them in a different order. So EARN, now there are some things that are out there from other federal agencies. EARN, Employer Assistance and Resource Network on Disability Inclusion. It's a DOL's Department of Labor funded center. Their March-April newsletter is full of good stuff. The EEOC guidance is particularly good about questions and how EEO laws fit into what we're watching now. Jan obviously has some really good stuff, and I think they even have a webinar on COVID and ADA. DOL has labor guidance on the paid and family leave because the new law, the CARES, what I was calling COVID-3, has additional paid leave and family leave. Maybe that's in COVID-2. Anyway, there's a really good explanation there if you're an employer, or even better, if you are working with an employer who doesn't have the guidance they need. There's some really good information, and for you to be a resource to them for what they're looking for right now is a really good way of cementing that relationship. Okay, next slide, Andrew. Another one, NTAC. NTAC also has some really good things. National Transition, I can't remember what NTAC stands for. National Technical Assistance Center on Transition. They have an entire page listing guidance, resources, sample documents. There's an online discussion with question and answer, people commenting back and forth. So there's lots of good stuff up there on providing services in this time and space to youth of transition age, students and youth of transition age. Just so that you know, there are 2 technical assistance centers that OSEP, Office of Special Education Programs, have appointed as TA centers for kind of their leads on COVID. The National Center on Systemic Improvement is the one for K through 12. There's one for early education. And then RSA and, next slide, WINTAC, which is the next slide, I think, are doing, WINTAC are the ones for RSA who are providing information in this time. WINTAC has 3 webinars coming up. You can see what they're about, very practical stuff on what's going on if you're working in this field right now, using social media, strategies, in a distance learning environment, employment prep and work-based learning in a virtual world. And I'm sure they're going to have more. The links are to the registrations, or you can obviously go to the WINTAC page. There's a lot more information there.
TikTok, really? TikTok?
That's what they say. I'm not making a comment. I'm not a TikTok user, so I don't know the answer. Although I think some of the universities may be using it. Anyway,
yeah.
Next slide. Can't remember what the next one is, Andrew. Project RED. So Project RED, Research and Education on Disability and Disaster, is out of Texas A&M, the UCED in Texas. They also have a whole list, and they have, if you're from Texas, there's a whole list of Texas-specific stuff up there, and a whole list of, and I know there's some Texas people who tend to call into this, and some local specifics also. But there's also a national list and a international list, and they have everything from, literally, I gave you examples, the American Red Cross, Better Business Bureau, American Veterinary Medical Association information, OSHA, I thought that one you might be interested in. And it's all tied specifically to COVID, or it's tied specifically to disaster, disability and disaster. But most of what they've got in their list right now is all tied to COVID. So if you're looking for something, I thought the veterinary one was, of course, I have dogs downstairs, but was interesting, and it's just a wide variety of stuff. Again, if you are working with an employer who doesn't have access to the right things, there are some things out there and you can help them. WHO has a new, World Health Organization has a new publication on disability considerations during COVID-19, just came out in the last, I don't know, 2 or 3 days probably. So that's that one. They also have, Project RED has existed before COVID, they will exist after. There's a lot of disability stuff up there, disaster stuff up there. So there's an acronyms list, there's online tips for first responders around disability and disasters, there's recovery toolkits, there's other stuff as well. It's a really good website. So I commend that one to you. And there are a couple of other really good disability and disaster sites. I'll pull, I just realized that I'm thinking of another one. I'll pull it up and stick it in the chat box. Okay, next slide. Small business. This is one, there are a variety of small business loans available from under COVID-3, under the CARES Act. Again, this is, now whether you're coming to this call from a small business, from a nonprofit, small nonprofit, which is a small business, from someone who works with students or adults with disabilities who are employed by small businesses. Again, there are a variety of interesting things out now. There is a loan program. I'm guessing everybody and his brother is looking for information on this loan program. I know they are because I'm hearing that on the news. I would be the first one to say that I don't think they have their act together yet, but they're, you know, meaning the government doesn't have it, how they're going to do it. But having said that, there are some, again, really good information out there. One is from the Chamber of Commerce. One, oh, that's us, Chamber of Commerce. That should be US with a capital, Chamber of Commerce. One's from the Small Business Committee in the Senate that lists everything together. I particularly like the Chamber of Commerce one. It says kind of who's eligible, what will lenders be looking for, how much can I borrow, will the loan be forgiven? It's very straightforward. It's only about 4 pages long. It's good for you to have. It's good to be able to share. And then there's a one-pager from the ARC that, and I will say, there are a variety of disability organizations out there doing really good work. So let me put a plug. Obviously, AUCD is, I think, doing really good work and has a variety of information up on our website. We're collecting stories, as a matter of fact, and I'll pull a link to that too. I don't think I did a, I don't think I had a slide on it. Stories from people with lived experience about what this is meaning to them. But the ARC has some really good materials up on their website. APSI around employment has some really good materials up on their website. You know, whoever it is, National Down Syndrome Congress, I saw yesterday did a webinar. Whoever it is that you normally hook in with, I'm guaranteeing they're going to have some things up on their website. But this one from the ARC is on stimulus payments and recovery rebates, and specific for people with disabilities. How does this work? And I haven't seen another one like this. So absolutely, that's a good one. That's why I gave you the link for this one. And it's one we're sharing as well. Other organizations, like I said, we're each taking kind of little pieces of what's going on in this world. And that's when the ARC is taken on. Next slide. Can't remember what's next. Workforce board partnerships. I share stuff from Workforce GPS with you generally. These popped up. There are 3 different things on how to do workforce board partnerships with various things going on in your community. So it's kind of like, how do you build a workforce board partnership with the community colleges, with the Chamber of Commerce, with the youth course. And there's then materials and examples on the page. I'm giving you the links just because I think this is a time when there may be a lot of, if you can breathe, so to speak, if you have a break, meaning you're not totally 150% involved in the actual, you know, the work you're doing right at this moment with individuals, and you're looking to build some other relationships, those relationships, this is a good time to build them. I think there are some other opportunities out there that partnerships are being built, and we can look at things in a new way. I will say I was on a call the other day and heard somebody say, you know what, this is interesting, and it made me think about you guys. And what they said was, you know, we've heard for years that, you know, it would be horrible, and what would happen if all of the sheltered workshops closed down? How would we ever get people employed? How would we ever move on from that? Well, guess what? Here we are. So can we find the opportunities to move people into competitive integrated employment? Can we find the new partnerships? Can we move the paradigm in a time when you wouldn't have expected it, but here we are. And I thought it was a fascinating conversation, and to think about that, and that's why I put these up there. I think the work with community colleges, the work with, who are also doing distance learning, as are you, the Chambers of Commerce, because they are obviously involved with the small business world right now, and the youth course. So I stick that to you, I give it to you. I know people are probably 150% busy right now, but at least, if not more. But this was an interesting opportunity, and I give it to you for what it's worth. Next slide, Andrew. We're almost done, I think. Think work may be the next one. Uh-oh. Let me see where my slides are. No, that's the link. Oh, there it is. Think work. Think work is, as I think probably most of you know, is a NIDE-funded project out of ICI Boston, and they have two new one-pagers out that are specifically targeted to employers. They're in a question and answer format. It's all part of their series on bringing employment first to scale. And again, just what I was talking about a minute ago, how do we bring employment first to scale? It's a good time to do it. So these might be great things to share with employers as we're looking at that process. Next one, Andrew. Last one, maybe. Yes. So, and this is from my friends at UNH, University of New Hampshire. Deb Brucker sent it to me to be shared in a different format. And I said, well, what about sharing it on the nTIDE? So UNH is doing a 6-week research study. They are looking for people with disabilities who are currently employed to test the effectiveness of job crafting. That doesn't read well, but that should be in job crafting in disability employment. So they'd work with people to develop job crafting goals and track that progress over 6 weeks. It's an online survey. There's information on how to get more information about that if you have somebody who would be interested. So I think that's the end of mine, Andrew. So I think it's time now. It is. So I get to introduce Valentina. Valentina Morales is the Senior Director of Justice Initiatives at the Wildcat Service Corporation, which is an agency of Fedcap. She works with people navigating the criminal justice system, and she created and is the director of the Women's Project. And so that's what we're going to hear more about today. Valentina, I'm going to toss it to you.
Thank you so much, and thank you to all of the organizers for inviting me to speak. I'm so excited to be here and to talk to you a little bit about the work that we do and who we are. And I'm not sure if this is my first slide, but just by way of background, the Women's Project is a fairly young program. We began our pilot year in 2017. We've been funded by the Open Society Foundation and by Robin Hood. And essentially the Women's Project grew out of a collective conversation between, or among rather, Fedcap, the different defenders in New York City, and the district attorney, first in Manhattan and then including Brooklyn. And essentially what we came together to talk about and to try to achieve was to reach women who were detained for prolonged periods of time pre-trial, so before there had been any kind of conviction or any plea, who'd been detained pre-trial because they couldn't afford bail. And particularly these women were women who often presented with some fairly complex needs and who would certainly fit definitions and descriptions perhaps of people with disabilities. And so in terms of what we do here at the Women's Project, my team, we really are kind of almost laser focused on providing holistic, really person-centered, trauma-informed, and it's incredibly important for us that it be culturally competent care. And that spans from detention through release and into the community over time. We also have kind of incorporated a pretty comprehensive advocacy component to the work that we do. We're interested in taking clinical tools and clinical support and pushing them into what may be some non-traditional settings like the courtroom, like the jails. We have a kind of foundational goal of building strong community and supporting women through stability. So we can go on to my next slide, please. So I wanted to give you a sense of who the women in our community are, which will help kind of contextualize the conversation and some of the things that I'd like to talk about with respect to our program model. So a good majority of women in our community actually have chronic mental health needs. About 56% of the women who are referred to us have in the past received some psychiatric diagnosis and have some past history of care. There are about 27% of women who, upon assessment, clearly had mental health needs that were not being met and they had no history of care. And about 41% of the women in our community have been previously psychiatrically hospitalized. There are about 62% of women who are in recovery or struggling through substance use disorders. A number of the women in our community, our age range spans from 19 to 61 years old. There are women who have kind of chronic health conditions and generally are, in need of kind of a consistent connection to quality health care. And one of the kind of more staggering statistics that we've gathered from the women in our community is that approximately 98% of them report a past history of some significant sexual, physical, emotional, or combination of those abuse. And what that brings both with respect to how those women engage in their own communities, how they engage in the workforce, how they engage in programming, and also how they participate in their defense. With respect to employment, we certainly have a significant number of women that, when referred, were unemployed and looking for work, about 48%. About 30% of women, actually, no, I'm sorry, about 20% of women were either employed full-time or part-time, and then a good number of women, a little over 29%, were receiving SSI and had not necessarily been working at the time they were referred or at the time of their arrest. Many of the women that are referred to us have been disconnected from care, and that could be as a result of their arrest. Generally speaking, we're in a kind of very resource-rich area, being in New York City, but have noticed is probably not the right word, have definitely received information and anecdotally watched difficulties in accessing care, which I know is something that anyone working with those impacted by the criminal legal system, or also those of various abilities, would be familiar with this issue of access, how difficult it is, either because services are siloed or screening becomes too difficult, or there are real difficulties in building engagement. And lastly, with respect to housing, so as you can imagine, housing in New York can be quite complicated, is incredibly expensive, and we certainly are in the midst of an affordable housing crisis. And so with respect to our community, only 26% of the women report having a permanent home address that they can return to. Other women were either in the shelter system, were in some form of unstable housing, staying with friends, or staying somewhere else where they could not return to, or a place that really wasn't safe for them. So that's just to kind of give you a sense of our community, but we can move on to the next slide, please. I thought it was helpful to kind of map out our goals and our commitment. It's something that we kind of keep present always. And so again, really just looking to find out who these women are in the jails. And I'll tell you a little bit more about how we did that in conjunction with some of our amazing partners, to really give them a trajectory for individual success that they define, by synchronizing these existing service components. So really not interested in reinventing the wheel, or in duplicative services, but kind of pulling together those elements that kind of have been severed and that people really need. We address early on, and I can't stress this enough, the obstacles to care and the collateral consequences that result from arrest and detention. And there are a multitude of these. And when we're talking about people who generally are advocating for themselves, either because of a disability or otherwise, this is incredibly important. And lastly, just our commitment, which is to coordinating, bringing together these siloed services in the service provision community, really advocating for cultural change in the courts and in the jails with respect to our community population, building strong community, which I can't stress enough, and advancing individual agency for these women in the system. Next slide, please. And so I thought that I would talk today very quickly about kind of 5 components of the project model that really, that we are using kind of to create impact in our area and with our specific community. They are, our partnership structure. I'll talk a little bit about a continuity of caregiver and our mobile team. The holistic advocacy component of our work, and the fact that we are built for kind of small replicable scale. We're not like a project that is designed, for instance, to serve 1,000 people, right, with multiple parts. And so I'll talk a little bit more about that. We can move on to the next slide, please. So in terms of our partnership structure, we spoke about kind of how the Women's Project began and who came to the table. And so in the kind of overall structure of the Women's Project, and the Women's Project really is us, the service providers, but in this overall kind of partnership, we have the defense teams taking an active role, the district attorney taking an active role, and then our own work. And I can't stress enough, I mean, what was interesting about this is, you know, the stakeholders here are generally opposing parties. And so thinking about how to keep these stakeholders not just invested, but active and at the table really was something that we had to think about and we had to design around. So in terms of the defense teams, and I'll just pause here to say, you know, we have been privileged to work with some really tremendous advocates. Jane Sampure is a woman at New York Legal Aid Society who coordinates their Women's Pretrial Release Initiative, and she's just a phenomenal advocate. And she certainly has brought so much to both our work and the work being done in New York around bail reform and pretrial for this population. And so the way that this is structured is that the defense team would provide early on in the referral. First of all, we only take referrals from defense counsel. And the reason there is because of the kind of gaps in communication and the impact that that had on individual participants in the program, individual defendants, women, et cetera. And I mean tremendous impact. And so the idea was, in order to, you know, do a whole host of things, manage people's expectation around programming and what's available to them, given that they are defendants in a criminal legal process. Acknowledging that for so many of the women in our community, they're almost psychosocial to death, if you will. They're consistently asked very invasive questions by people that they don't have a relationship with. And so we wanted the defense team to be able to provide some of that psychosocial information up front, which they need anyway, so that, you know, if it became really apparent that we didn't have the support needed on our team to work with this woman in the community, that we could let the defense know before we met with her and started to ask some similarly invasive questions. And so defense teams provide us with psychosocial information. They have to agree to create a bail application. As I said before, women are referred to us because they cannot afford their bail and they are incarcerated as a result. And then they will keep us abreast of kind of what is happening in the legal case so that we can also kind of increase support and modify services around that. The district attorney agreed that they would review any bail applications submitted by the defense in an expeditious way. I know this sounds like it's not a big deal, but when you consider some of the delays that we were experiencing, and I'm sure people across the country experience in terms of local criminal process, it makes a huge difference. And has a tremendous impact on obviously individual well-being, but just keeping women connected to services. They wouldn't make procedural objections. These are really legal issues, and they, you know, themselves agreed to kind of review who the women were in our city jails. And then obviously there's the work that we do, which I've already discussed. Next slide, please. So one thing that we have done, which is slightly different, is, you know, we've taken this continuity of care model, but to another level. And we use what we call a continuity of care giver. And granted, you know, a lot of what we decided to incorporate into the project model, we drew from other really amazing project models, right? You know, for instance, ACT teams, et cetera. But the continuity of caregiver really means that for women who are referred to the Women's Project, an LMSW, a social worker, they will have the same social worker do the screening, provide support to them while they're in detention, provide some of the courtroom advocacy that we do, which is not the same as legal advocacy, and the case management, and then meet them in the community at release and continue with them through the trajectory of their engagement in the project. And so we've taken kind of what in other projects is broken into 3 or 4 people and merged that into one person and then brought the numbers down, right? So that we have really kind of highly trained professionals working with women, doing a lot of the frontline work. We're an integrated team What that means is that, you know, we have social workers, we have community outreach specialists who are really people with lived experience that ground our work and bring that combination of lived experience and professional know-how to the work that we do. We're mobile, so the idea is we're not in a centralized space if women come to us always. We do have a centralized space, but we kind of take our support into hospitals, into clinics, to the courts, obviously, to HRA offices, and again, trained LMSWs are our frontline staff, really. Next slide, please. Next slide, please. I'm still seeing the continuity of caregiver and mobile team slide. I'm not sure if you can change to the next slide. Andrew, can you hear me? Could we go to the next slide, please?
My internet just went down, and I'm getting back up.
Oh, sorry.
Requesting control of the slides again. Ferris, if you're out there somewhere, could you give me control of the screen? Yeah, the whole internet just shut down for a brief second. All right. Trying to scroll down.
Great, thank you.
Okay.
So the next component I wanted to talk about was advocacy. And we are not kind of by definition advocacy project, but we have incorporated this sense of holistic advocacy into our service provision. And so when we're you know, speaking with women and assessing for needs, we are also conducting an assessment for advocacy needs, you know, meaning, for example, many of the women who have children and are arrested and detained, there may be family court involvement as a result of the arrest and detention. And so making sure that they're connected to legal counsel for family court proceedings. Many of them are facing eviction proceedings. Have they been effectively connected to advocacy for housing? With respect to health, I mean, I'm sure that all of you know, but statistically, Black and brown women, the negative health outcomes, in part as a result of just really not being heard, I think have been well documented, or are certainly beginning to be well documented. So really thinking about advocacy in the healthcare setting as well, and conducting that assessment, and then really bridging communication gaps between legal teams so that women are able to actively participate in legal proceedings. I'll give you an example. It was and continues to be fairly frequent that a woman would have a criminal court appearance and a family court appearance scheduled on the same day at the same time, right? Making it impossible for her to participate in the family court proceeding effectively. And so just trying to bridge the gap between her legal teams so that that doesn't really happen. We do a lot of advocacy, obviously, aside from the legal advocacy. We also support self-advocacy, which is huge. I can't tell you, the women in our community are really remarkable, resilient individuals, and they are often incredibly adept at self-advocacy, but we've built that as a component of our programming to kind of support that and advance that. And that includes collective community advocacy, meaning that we kind of come together as a community to discuss things that impact, you know, the women. And these may be conversations about jail design, jail structure, about things that have to do with the criminal legal system or parental rights or, you know, healthcare. And we will be part of the kind of community conversation in greater New York City about those issues and really using our collective voice to be present. Next slide, please. And lastly, this idea of kind of small replicable scale for us is important. So again, you know, this idea that I've put here, you know, kind of like building the whole car as opposed to using an assembly line. Our staff are trained both by, you know, an attorney and a clinical specialist to have kind of a varied skill set, and certainly are given information about different systems that converge on the criminal legal system and what that means to individual women. And again, as opposed to having a separate case manager and a separate person that runs groups and a separate person that does the screening and a separate person that does courtroom advocacy and support, we've kind of pulled that all into one person, and that has effectively helped us increase engagement and really keep women connected despite some of the significant barriers that these women are facing on a daily basis, which really have nothing to do with us and everything to do with, well, I guess that's not accurate, everything to do with the world that we live in and kind of how we function. So we have smaller teams, more highly trained members. We try to do a lot of consistent training, value consistent supervision and processing and sustainability of work for the people on our front line to make sure that they are getting what they need to continue to do the work in a way that's effective. This idea of community and reinforcing the value of civic engagement certainly is something that we've kind of set down as a cornerstone of what we do. And, you know, the idea of every participant being part of decisions that we make in the project and around services, which we really drew from the Clubhouse model. I want to credit that model because I think it's just tremendous. And, you know, using this idea of collective civic engagement, meaning our community and our larger community, what projects do we care about? How can we volunteer as a community to really enhance that connection, which certainly provides for long-term positive outcomes for women. Typically, just so you know, when bail is set and bail reform has brought a significant change to the city, obviously, and a welcome change, but oftentimes, and outlined in the statute, judges are considering individual connections to the jurisdiction and what that means, and having a strong community support and being connected really does make a difference in the analysis that judges undertake when imposing bail or bail conditions. And so making sure that people are anchored to strong community, not just, I mean, obviously because of all of the positive effects of that, but really also to keep people who are presumed innocent free from detention when they cannot afford their bail. And then lastly, you know, just kind of really pushing to create space for a collective voice for the community in some of the external discussions. We can go to the last slide, but I think the last slide is really just my contact information. So I want to say again to everyone, thanks so much. I'm happy to answer any questions. I specifically kind of chose speaking about the elements of the project because I know that given present circumstances, we're facing some really daunting challenges in the months ahead with respect to employment, with respect to communities of people with various needs. And when we began working with the participants in our community, oftentimes they were presenting with needs that made things seem nearly impossible, and using and anchoring our work in some of these components really helped us find the right recipe, both for seeking release and for supporting women in the community. So I thought that thinking about how we can use some of those to address upcoming issues might be helpful, just kind of basis for conversation in individual groups with all of you. So thanks so much.
Thank you, Valentina. We only have a few minutes, and there have been quite a few questions that have been answered already. Valentina, you may want to at some point ask Karen for the list of questions and people who ask questions, because you may have some responses to them as well. I think probably Denise, you're out there. You're out there answering some of the questions. One question that comes in is something about DV support. Do you know what DV stands for? I don't, so.
Domestic violence, is that?
Okay, yeah. So in terms of
Certainly,
domestic,
yeah. So support for survivors of interpartner violence, we certainly provide that. And we have very strong relationships with programs in the city so as part of the work that we do, we hold self-care, what we call self-care and self-advocacy workshops weekly. We often invite other community-based organizations in our space to conduct those workshops, to give presentations. And the purpose is twofold, right? It's so that, you know, as a community, we're creating a collective network with other providers that can really do a deeper dive where people need additional support. And also, you know, it helps each individual woman to create a network so that she doesn't have to come back to the Women's Project to connect with that external provider or that agency. And so, yes, we have a very close relationship actually with a phenomenal program in New York called Steps to End Family Violence. And we provide with our, you know, through our social workers, a lot of support around IPV, but we also work very closely with Steps to connect women to that specialized support.
Yeah, it's going to be interesting to see with the social distancing policies and lockdown policies. There is apparently a rise in family and domestic violence because people are at home together longer. And have fewer outlets, how victims respond and are able to get support when they're told they can't leave the house, or services may be at a distance as opposed to face-to-face. Okay. All right, well, thank you. We've reached the end of our time. Thank you, Valentina, for coming in. People can reach Valentina directly, or you can reach out to us and we'll try to get you the resources and questions. Again, this will be posted online. And if you have any questions, feel free to contact us. Thank you, everybody. Have a really good afternoon, and stay safe and take care. Bye-bye.
Thank you.